Today on Nursing Matters, we're talking about one of the most mission-driven career pivots in healthcare, transitioning into global health and NGO work. But before we dive into that, we've got some big nursing and healthcare workforce news to break down, including hospitals trying to stop a retirement wave, how AI is changing candidate interviews, and the healthcare employers new grads are paying very close attention to. I'm Christina, and this is your daily dose. Let's get into it. First up, Becker's Hospital Review is reporting that hospitals and health systems are actively trying to slow down a major retirement wave across healthcare. And honestly, this is bigger than people realize. Healthcare isn't just losing nurses, it's losing decades of institutional knowledge. Experienced nurses are stepping away from bedside care, leadership roles, education, specialty departments, case management, and operational support roles, and replacing that level of experience is incredibly difficult. So what are organizations doing? Well, flexible schedules, phased retirement programs, mentorship positions, reduced hour leadership transitions, knowledge transfer initiatives. And frankly, this is smart because healthcare made a huge mistake for years. It treated experience like it was easily replaceable. And as we all know, it's not. A nurse with 25 years of emotional intelligence, patient communication, triage judgment, and crisis management skills cannot simply be replaced with orientation modules and staffing ratios. And for younger nurses listening today, pay attention to this trend. Because as this retirement wave continues, leadership and specialty gaps are opening everywhere. Think of public health, case management, leadership, clinical education, population health, home health, operations, care coordination. Healthcare is entering a major transition period, and that creates opportunities for nurses who are thinking strategically. Next story. Becker's also highlighted that Children's National is rethinking candidate interviews in the AI era, and this is fascinating. Healthcare leaders are now trying to figure out, how do you assess authenticity when candidates have AI-generated resumes, AI-assisted interview prep, AI-written cover letters, and AI coaching tools? And honestly, this conversation is only beginning because AI is changing recruiting and hiring very quickly. But here's the important part for nurses. Technology may help candidates prepare, but healthcare still only hires humans. Communication, presence, emotional intelligence, clinical judgment, trust, adaptability, those things still matter tremendously. You can absolutely use AI as a tool, but AI cannot replace authenticity. And I actually think nurses who combine strong people skills with technology literacy are going to thrive over the next decade. And finally, Forbes released its list of America's best employers for new grads for 2026. And this matters because newer nurses and healthcare professionals are looking for something very different than previous generations. Yes, as always, compensation matters, but so do mentorship, onboarding support, leadership culture, flexibility, growth pathways, and mental health support. According to Forbes and Statistica's national survey, some of the top-ranked healthcare employers for new grads include Mayo Clinic, Nationwide Children's Hospital, Memorial Hermann Health System, Cleveland Clinic, Houston Methodist, Cincinnati Children's, St. Jude Children's Research Hospital, Community Health Network, Children's Hospital of Los Angeles, and Honor Health. I'm super excited to see that 3 of those on the list are in the Buckeye State. Honestly, there's a lesson here for healthcare leaders. The organizations winning with younger clinicians are not just offering jobs, they're offering development, including strong onboarding, mentorship, healthy leadership culture, growth opportunities, and career mobility. The old sink or swim mentality, that's becoming a recruiting liability. And for new nurses listening today, do not just evaluate compensation, evaluate support systems, because the environment you enter during your first few years can shape your confidence, your burnout level, your leadership development, and your long-term relationship with the profession itself. Quick pause. If you're looking for your next nursing opportunity, visit the RN Network job board at rnnet.org. Travel nursing, leadership, public health, specialty care, home health, and more. Built for nurses who want to level up their careers. Now back to the podcast. All right, let's talk about something a lot of nurses dream about, but very few understand strategically. Global health and NGO work. This space gets romanticized online all the time. People picture mission trips, international travel, humanitarian outreach, saving lives overseas. And yes, some of that absolutely exists. But from a career standpoint, global health is much more operational than people think. NGOs and public health organizations hire nurses based on adaptability, autonomy, documentation, education skills, cross-cultural communication, crisis management, population health thinking, community engagement, not just compassion. And honestly, that's what makes this field so fascinating, because the strongest global health nurses are usually not the loudest people in the room. They're steady, flexible. They're operationally mature and calm under pressure. Now, here's something important. You do not need to start internationally to eventually move into global health work. In fact, many organizations prefer nurses with strong real-world healthcare experience first. And this is where a lot of nurses accidentally undersell themselves. Emergency department nurses, huge global health potential. Community health, very strong fit. Home health, they have a massive advantage. Behavioral health, case management, maternal child health, public health, infectious disease, refugee health, correctional health, all highly transferable. Why? Because global health work is often less about dramatic hero moments and more about navigating systems, education, trust building, and limited resources. That's the real work. And another thing nurses should understand, global health today is much broader than international travel. This now includes population health initiatives, remote education programs, refugee health systems, NGO coordination, disaster response, community partnerships, digital health access, health equity programs, telehealth outreach. This field is evolving rapidly, and honestly, AI and technology may dramatically expand global healthcare access over the next decade. But there's one thing technology cannot replace: human trust, especially in vulnerable communities. And that's why nursing still matters globally. Now, if I were coaching a nurse trying to pivot into NGO or global health work, here's what I'd focus on first. Build operational credibility. Not savior energy. That's important. Organizations do not want candidates who romanticize suffering. They want professionals who understand complexity. Can you educate effectively? Can you adapt quickly? Can you work cross-culturally? Can you manage imperfect systems? Can you stay composed when resources are limited? That's what gets hired. Second, Build proximity before trying to leap internationally. Focus on volunteer work, community outreach, vaccination initiatives, refugee clinics, population health programs, local nonprofits, and public health departments. You do not need some giant dramatic overnight pivot. You need proof points. Third, your LinkedIn absolutely matters. If your profile screams only bedside nursing, but your goal is global health, you need to shift the narrative. Start highlighting your education, population health, any community engagement, health equity interests, cross-functional collaboration, and your outreach work. Consistency matters. And finally, understand that global health work is emotionally meaningful, but emotionally demanding. You will encounter trauma exposure, resource limitations, funding issues, operational chaos, perhaps burnout, and cultural complexity. The nurses who succeed long-term are the ones who combine purpose with sustainability. And honestly, I think this next generation of nurses has enormous potential to reshape global healthcare in ways we haven't even fully realized yet. So today's big takeaway is this: healthcare is changing rapidly. Retirements are reshaping leadership. AI is reshaping recruiting and hiring. Public health and NGO work are continuing to evolve, and nurses are going to play a massive role in what comes next. But career growth today requires strategy, not just passion. The nurses who position themselves intentionally are going to have incredible opportunities over the next decade. And maybe your next chapter isn't just another hospital floor. Maybe it's leadership, public health, NGO work, maybe it's global outreach, or maybe it's something you haven't even considered yet. But don't underestimate how transferable your nursing skills already are. If you enjoyed today's episode, please like, subscribe, and share Nursing Matters with another nurse who's thinking about their next career move. And as always, keep growing, keep learning, and keep building the career you actually want. That's your daily dose. I'm Christina, and this is Nursing Matters. See you tomorrow. Thank you for listening to this week's episode of Nursing Matters Daily Dose. Are you interested in more career resources? Then hop on over to the RN Network at rnnet.org. Also, while you're at it, hit that like and subscribe button and share this episode with one nurse who really needs to hear it. Thanks so much, and we'll see you next time.